Hello, my name is Maira Carrier, and my capstone project is based on my daily work with You Matter Not Alone nonprofit organization, where we provide child mental health services for California, Texas, and communities across Uganda, Africa. My capstone program is focused on mental health educational awareness for Uganda. African countries have a competing health and developmental priorities with insufficient funds to address them all. As a result, mental health care is severely underfunded. Data recorded in health management systems do not include mental health, which contributes to an underappreciation of the disease burden in countries across the continent. Lack of data means that policymakers cannot comprehend the depth of the problem that countries are facing. Therefore, mental health has been and continues to be at a crisis in Uganda. In Uganda, mental, neurological, and substance use disorders are a major public health burden. Depression, anxiety disorders, and elevated stress are most common, sometimes leading to suicide attempts. Children make up about half or 56% of the total population, and they often present with multiple physical, mental health, and educational challenges. When screened in Ugandan primary care clinics, 12 to 29% of children presented mental health symptoms. This is very important to note as we start understanding the dynamic of what happens in Uganda and the limited resources. Just because 29% of children were identified as having mental health symptoms that needed to be treated, it doesn't mean that all 29% of those children received medical attention for that mental health symptom. So parents and guardians are limited in the access that they can have to mental health doctors, financial resources, and even transportation to be able to give those resources for their children. Program purpose. This program is composed of multiple self-soothing and positive coping mechanisms aimed to improve mental health awareness, education through a holistic approach. The facilitator workbook was developed alongside the program, including its design and implementation that can be utilized to aid mental health throughout multiple levels within the communities of Uganda. Through the health belief model, this program aims to create a balance between the Ugandan communities, what the Ugandan communities perceive as their susceptibility, in this case, mental health, and its severity. This will determine their likelihood to use the positive coping mechanisms learned through the program. Here we can see an example of how this program can have an overall impact. The demographic variables range from age, gender, socioeconomic status, to name a few examples. The social-psychological variables range from location, education, mental health knowledge, and personality. The individual's belief section focuses on the perceived severity of mental health, perceived self-efficacy, or the ability to produce a desired or intended result, and the evaluation of behaviors to counter threat. Lastly, perceived benefits of the program and facilitator workbook. For actions, we start seeing behavior change and reduce the threat based on expectations. This is a time where we start seeing that the children are using these coping mechanisms, and hopefully that triggers something within the parent to become curious and also want to learn from those coping mechanisms that are working for their child. Program design. The facilitator workbook consists of 4 coping mechanisms that are geared to help children self-regulate and cope with everyday life triggers: breathing, superhero pose, affirmations, and self-love. My capstone program revolves around mental health awareness and education. The facilitator workbook was developed alongside the program. The facilitator workbook is a centralized workbook on coping mechanisms for children, mental health professionals, and other members of the community. The first coping mechanism is breathing. Breathing exercises are an excellent way for children to self-soothe. Research indicates that breathing exercises can be advantageous for people in several ways. and that they can be both positive for mental and physical health. This program targets to help multiple levels of the community. Here we can observe that the facilitator workbook has a step-by-step guidance for facilitators, the community, and even includes a visual page for those that require visual aids. Outcomes. Some outcomes include coping mechanisms, mental health education, interpersonal safety, self-understanding, and everyday general functioning. The program design. So, why holistic? A holistic approach means to provide support that looks at the whole person, not just their mental health needs. The support should also consider their physical, emotional, social, and spiritual well-being. Each person will have a different experience of mental illness and a path to recovery that is influenced by their age, gender, heritage, language, faith, gender, identity, relationship status, life experience, and beliefs. Broader implications. This project has the potential to have a positive long-term effect to improve child mental health awareness, break generational traumas passed on due to mental health illnesses, and improve mental health at multiple levels throughout Uganda. Through the cultural considerations, the program has the potential to be translated, distributed, and implemented throughout multiple areas of the world and to improve overall human quality of life through positive mental health awareness. Here are my references. Thank you.